Hi, everybody. This is Lee, and I'm talking about healthcare again. That I've been kind of watching and waiting, and I'm observing the discussion around Bernie Sanders' bill that he just introduced. Sure enough, right on schedule. At the same time, he introduced the single payer bill, the Medicare for All Act of 2017. The Republican Party made its other effort at repealing Obamacare. And so there's an attempt to change the narrative away from talking about single payer to once again defending Obamacare. And less people are inclined to do that. That even those senators that co sponsored Bernie Sanders' bill have been saying, oh, well, we need to save Obamacare again. And it's just not getting a lot of enthusiasm. That, there is concern about the repeal of Obamacare, and I can remind people that it's just not an attack on Medicaid, but it's also an attack on the single payer system that exists right now in Libby, Montana. That's covered under Obamacare. You take away Obamacare, you don't have Medicare for all in Libby, Montana. And that also in certain coal states that Obamacare provides black lung benefits. You take that away, so there are concerns, and not just for Medicaid, although that is a major concern for like Senator Susan Collins of Maine, that quite a few of her constituents rely upon that, and that she may be she's already indicated that she's a no vote. That Rand Paul has already indicated that he's a no vote, and again, for different motivations. He says it doesn't go too far or far enough to repeal Obamacare, that there's still some protections in there, and that it's just a way of shuffling money away from the blue states towards the red states, and that Paul Ryan should take care with counting of the votes in his house, because according to Rand Paul, Paul Ryan has miscounted votes before. And and so that there are Republican members in states like California and New York, and that they would be obligated to explain to the constituents why they lost funding to states such as Mississippi and North Dakota. And how are they going to do that? And how is Paul Ryan going to convince these Republican representatives in California and New York to actually want to do that? So Rand Paul's, like, no, and people are asking him, like, Trump, are you going to vote for this? And he's like, no, I'm not. You're a negative force. No, I'm not. So that's interesting. There's agitation. Apparently, they claim, these Republican senators and representatives complain that there's agitation by their base to repeal Obamacare, and that according to Senator Charles Grassley, it's not even that there's anyone paying attention to the substance of the bill. It's just the fact that, well, you said you were going to repeal Obamacare, so do it. And it's almost like it's become a crusade, and that's no longer making sense, the whole entire point of it, even though it's causing more harm than good. It's, we said we were going to do it, and so we're going to do it. And that's the mentality that's driving this. That you made your promise, now you have to keep it. And so it's Bill Cassidy, Louisiana, and South Carolina's Lindsey Graham that are have concocted this legislation, and they're driving it, and they're trying to sell it to the public. Although, again, they claim that their base wants it, so who are they selling it to? The base already wants it. It's a hard sell, and they can't sell it by saying, well, if you don't support this bill or insist that your congressman supports this bill, if there's not enough support, well, then you're going to get single payer, because it might have the opposite effect of, wait a minute, if we get single payer, yes. So they can't even, convince their base like that. They have to say, well, if you don't support our bill, well, then it's going to be communist Russia here, and you'll be forced to have health care 24/7. They can't sell it like that. So anyway, their bill it would end the individual mandate, the requirement that people buy health coverage or pay a penalty, and that larger employers have to provide it to their workers. It would allow large insurers to charge higher premiums to people who are seriously ill with pre-existing conditions, and it would cut Medicaid, the health insurance for the poor, over time. That money from the law's Medicaid expansion and cost reductions it provides to lower earning people, it would be folded into block grants dispersed to the states, 1.2 trillion over 7 years, with a few federal strings, well, hardly any strings attached. And so right now that Medicaid expansion is even in certain red states, and so with this, it would be optional that they could have these block grants and choose to use it or not. And so, there's appeal to the Republican idea of, um, countering anything with Barack Obama's name on it. And then also shipping more power and plenty of money back home to certain states. And so Rand Paul has pointed out that it's just a way of shifting money around. It's not actually cutting spending, which is what he wants to do. He wants to cut spending. And so he's saying that with this bill, it's actually not cutting spending, that it's just rearranging chairs on the deck of the Titanic, taking money from states such as California and New York and redistributing it to states like North Dakota and Mississippi. It's still spending, and that he's going to oppose any bill that includes spending like this in terms of not paying attention to our debt ceiling. So different motivations, but he's making the right votes. You just have to take it like it is, and I do. And so, again, it's the September 30th deadline when there's the special protections that shield the measure from needing 60 votes to pass. So if they don't pass it by September, if they can't get their majority with what they have to pass it by September, then they won't have enough to meet the 60 vote requirement after the deadline. And so Susan Collins of Maine has also expressed concerns in that she is unlikely to vote for the measure. The Medicaid cuts are the issue, and that there's questions about Lisa Murkowski and John McCain, where they stand on that. And so Donald Trump is kind of taken to Twitter to lobby and enforce his view that the measure should be passed. And that people have seen him use that Twitter on McConnell of Kentucky and don't really want that to happen to them. But the thing is, the idea of single payer is out there, and people have spoken of it. It's come into the national discussions, becoming normalized, and people are overcoming the false narratives surrounding it. More information is getting through. And so it's becoming a harder sell. And that even the fact that, and we know how hard the sell against, for this bill is, because John Kennedy of Louisiana, he's a senator, said he plans to propose an amendment that would bar states from using their block grants to set up state-run insurance systems. So they're talking about states' rights and returning money to the states, and how great that is for conservatism. But now when it comes to, well, you know what, these states might use that money that we send to them to set up a single payer system, because lots of states are working on single payer, that we can't let them do that. They have the right to, restrict Medicaid, but not to expand it to the point that it becomes a single payer system. They don't have the state's rights to do that. Not on my watch. And so go figure that dichotomy. Anyway, so lots of controversy about healthcare that's ongoing, but it's good, that it's being discussed. and that more and more people are aware of what single payer is, and that it's not some kind of commie Russia plot against them to force them to have healthcare 24/7. You will be healthy. We'll make you be healthy. No. And more people are realizing that, it's not socialism or communism to have health care guaranteed by the United States government, that it's yet another service that we have uh, guaranteed to us, like our military defense, our National Guard, uh, our local police, all guaranteed to us as a government run system, unless they are considered socialism, like our socialism police force, our communist National Guard. I mean, what are people saying? It's not making any sense at all. Our firefighting, our transportation, public works, our sewage system, our garbage pickup, government run, communism, I guess. We have communist firefighters that go around putting fires out and not charging for it. Okay, and disaster relief. And so, you add medical care to that, and it's not such an aberration. Like, of course, emergency services, disaster relief, firefighting, medical care. What's the difference? It's not making any sense. So the gaslighting, it's not working so well. And there's a new urgency that these talking points that the Republicans are using to sell their horrible bill is failing. And people are just not, it's, you can see the desperation. And, desperation is not a good selling point for any legislation, I don't think. And so it's becoming really apparent as cracks forming. Certain senators and even some representatives are knowing that they have to answer to their base, the base that wants health care without restriction. So anyway, I'll post some links to give everyone kind of an update on what this new effort is. And the unfortunate part that there's an attempt to refocus attention away from Bernie Sanders' single payer bill towards, saving Obamacare, but people are not buying that anymore. And that you have people such as Al Franken, Elizabeth Warren, Kamala Harris, people who ostensibly co-sponsored Bernie Sanders' Medicare for All bill, and they're not really out there trying to sell it. They're doing their old Save Obamacare shtick and making themselves look kind of stupid when they're doing that. And people see through that, that they want single payer and that they're willing to fight for it. Even in the face of this usual timely trick of, the Republicans are out to get Obamacare, save Obamacare. And people are like, no, we want single payer. So anyway, I'll let people look at these articles and see what they think. Good luck.